Lawmakers are racing to implement a plan to prevent a spike in health insurance costs for Obamacare recipients. The Senate will hold key votes today while several senators put forth their own ideas. Joining us live to discuss is NTD's Melina Weiskup. Good morning, Melina. What's each party's plan to address Obamacare subsidies that are expiring in 3 weeks?
Hi, good morning, Steph. So the Senate is going to vote on two bills today, one from the Republican side, one from the Democrat side. Now, remember, the Democrats' bill is for a clean extension of COVID-era Obamacare tax subsidies for the next 3 years. Remember, Steph, this was a vote that Senate Majority Leader John Thune agreed to have as a way to get those Democrat votes needed to reopen the government last month. So it was part of that agreement there. Now, Republicans are countering this proposal with a plan of their own. Their plan would take the money that's granted to the subsidies and put them into healthcare savings accounts to help Americans pay for out-of-pocket costs for healthcare. Listen to what both sides are saying about the proposals.
So, with just days left on the clock, the clearest, cleanest, easiest, and best path left is the bill what Democrats are proposing. A clean extension of current tax credits. That's it. No poison pills, no gimmicks, just relief.
The proposal we'll put out there will bring insurance premiums down. It will be fiscally responsible, and it'll get us away from the practice of giving the money all to the insurance companies and put it back in the hands of the patients.
Now, President Trump a while ago floated this idea of having the health care savings accounts as an alternative to Obamacare. So that proposal from Republicans, since it does have Trump's backing, it could be easier to push through Congress with respect to getting Republicans on board with it. But since no Democrat support is likely to be on this bill, it likely won't make it through the Senate. Now, because Senate Majority Leader John Thune scheduled a vote on both the Republican and the Democrat proposals, that indicates that there's not bipartisan consensus on either proposal to get enough votes to get either proposal passed.
Now, there's more than just these two ideas. There are several bills, even bipartisan ones, that are floating around the House at the moment. Where do those efforts stand?
Right. So when you look at the House, there is a similar situation going on with respect to House leadership. So the Democrat leaders want to extend Obamacare subsidies for 3 years, similar to the Senate's version, but that plan won't see even a vote in the House. Here's why, according to House Speaker Mike Johnson. Listen.
There's a lot of people who are very concerned about Obamacare and the fact that the subsidies were created by Democrats for COVID-era limited use and they want to be extended. We just can't get Republican votes on that for lots of reasons, not enough of them. And so, look, my colleagues...
So, Steph, in the House, the Republican leader is not even bringing up the Democrats' bill for a vote like Senate Leader John Thune is doing in the Senate. Now, House Republican leadership says they're proposing a plan of their own, and they're planning to vote on that proposal next week. But the details of that plan haven't yet been rolled out. It's expected to be similar but slightly different than the Senate Republicans' plan. Like you mentioned, there are several bipartisan efforts underway on the health care front. One, of course, we reported on last week. The group is proposing to extend the program of Obamacare and make reforms to address how much government money is actually going towards the Obamacare subsidies. Now there's a new bipartisan effort underway on a discharge petition. Now, Steph, that would force House Speaker Mike Johnson to hold a vote on those expiring Obamacare subsidies. That bill would extend the enhanced subsidies through 2027, but it also addresses fraud and tries to rein in some of the practices of pharmacy benefit managers. Of course, we know those are the middlemen of the prescription drug supply chain. But, Steph, that petition needs 218 lawmakers to sign on it in order to even force a vote to begin with. And it's unclear if that vote happens, what the support would look like. But I will say that at this point, there are several Republicans in the House that are pushing for at least a 2-year extension of those Obamacare subsidies just to make more room and cushion to make more time for other reforms to the program, Steph.
Watching it all very closely. Thank you so much, NTD congressional correspondent Melina Weiskup.